My name is Jeff Reeves and I'm the Nursing Director for the Patient Flow Service at Toowoomba Hospital. So the emergency department provides care for our community in what can often be emergent life-threatening situations. So we're here to protect our community. We see both children and adults in our emergency department, so we're a mixed ED, and we can see anything from significant trauma, whether that be motor vehicle accident, farming accidents as an example, right through to fractured limbs, so arms, legs, to people having a viral illness or a bacterial infection, eye injuries. We see it all. So the emergency department is vitally important to our community. It provides expert care to all members of our community and beyond. We're quite a large catchment area, so we'll see patients from northern New South Wales, southwest Queensland and the immediate Toowoomba area. So we have lots of patients coming to us on a daily basis, and the care that we provide can quite often be life-saving care. So it's vitally important for our community, for our families. So what we do is pretty amazing. We support our rural counterparts, and like I said, it's not just Darling Downs, it's also into southwest Queensland, northern New South Wales catchments. Basically anyone, if there's a higher level of care that's provided that Toowoomba Emergency Department can provide, the patients will come to us, and that they might be coming to us for particular procedures, life-saving intervention, theatre, medical imaging as well. So certainly patients will come to us for all facets of emergency care. So my role as Nursing Director is supporting the staff on a daily basis who provide emergent care. The work that's undertaken by the Emergency Department team is phenomenal, and they do it again and again on a daily basis. And so being able to support that team for whatever they need on a daily basis, that's what I find most rewarding. So a typical day is we generally review the day before. We're looking to see what situation is the emergency department in. So are we at capacity? Do we have capacity? Because we have a pretty good idea on the activity that we'll get throughout the day and when that will occur. So what we really need to do is ensure that there's adequate capacity, services, resources, etc. available for the emergency department, so that when patients start arriving to us in volume, that we're able to better get the patient at the right place at the right time. So that's predominantly what we do first in the day, regular updates throughout the day. The emergency department is very well supported by the health service, and it's amazing support. What the foundation allows us to do is sometimes get those extra, the extra equipment, the extra support for our staff, additional training for our staff. The foundation will fund training opportunities for our staff across the hospital. And certainly a number of pieces of equipment that we've had, these can be life-saving pieces of equipment. So in the past we've purchased ventilators, cardiac monitoring, etc. And that goes straight back to the community. So we are providing care to members of our community with vital equipment that's been funded by the Toowoomba Hospital Foundation. There's certainly a number of pieces of equipment that we'd like to purchase for our emergency department, and I think through the generous donations of the tax appeal by members of our community, we'll much better be able to get that equipment and use that in a way to benefit our community.